I suppose it's good afternoon. I'm Peter Doherty from across the street, and Grant MacArthur asked if I would chair this presentation by Katherine Barraclough, because we're both interested in this whole climate space. We're going to run for a total of 1 hour, and I think Katherine's going to speak for 45 minutes. Then we'll have time for questions. When we are doing questions, we'll have to be disciplined and use the microphone because it's also being recorded and it can be accessed via the internet. So here's a chance to be on the movies. Well, of course, we must acknowledge the traditional owners of the land, the Wurundjeri people of the Kulin Nation and their elders past and present. If we're talking about climate and environment and so forth, it's truly extraordinary for us as Australians to know that some of our community are part of the oldest continuous culture in the world, and that they dealt over those 50,000 years or so very effectively with this rather at times harsh and hostile climate. It's also very intriguing that there are stories within the local community that remember back to a time when the Yarra River flowed directly into the sea, which means they're remembering back to before the end of the last ice age. So it's interesting that's been handed down through the oral tradition. So Katherine is a nephrologist. She's a real doctor and has worked in India and other places. She's also an associate professor in the University of Melbourne, has a PhD. She's more than 40 publications, primary papers and review articles, and she's very involved in the sustainability area, both through a special interest group in the Australian New Zealand Association of Nephrologists, and through, I think, Environment Australia and Doctors for the Environment Australia, which is active in this space. As we were discussing earlier, this is kind of frustrating to get action in this area, but we can only drive along at it as hard as we can. And it's great that Katherine's taking up the challenge, and I'll sit down and listen to her.
Thank you. So I would also like to start by acknowledging the traditional owners of this land, the Wurundjeri people of the Kulin Nation, and paying my respects to elders past, present and emerging. As suggested by Professor Doherty, this is always obviously important, but I think particularly so with any presentation on the environment, because there really is just so much that we can and need to learn from Indigenous Australians about environmental stewardship. I'd also like to thank the organisers of this lunch meeting for inviting me to speak, and to all of you for choosing to attend. This topic is probably still a fair way from being a mainstream one in healthcare, but I really think such an important one, so I really do appreciate the opportunity to speak. So as my first slide said, I'll be talking for the next 45 minutes or so on some of the links between the environment, health and healthcare, but I thought I might start by just explaining a little bit about how I became interested in this topic, because as I said, it's not really a mainstream healthcare topic at the moment, and probably at first glance it's a fair way from my specialty of nephrology. And so I suppose I've always been interested in environmental issues to some degree, but I was never particularly well informed or engaged until probably 6 or 7 years ago now, around the time that I completed my PhD. And at that time I suddenly had more time, and I started reading more broadly about a range of things, but particularly about environmental issues. It actually started with me reading about the issues surrounding meat consumption, but I very quickly from that learnt about many of the broader issues with our food system, about things like pesticide use and ocean dead zones and overfishing. And then I leapfrogged to reading about deforestation and the appalling rate of species extinction that's really going on sight unseen all around us. And then about climate change. And the end result of this was that over a relatively well-defined period of time, I learnt quite a lot about these issues. And I became really very overwhelmed and quite depressed by what I saw as the extent of all of these environmental problems facing us. So this is a photo of my youngest son in the Otway Ranges, which is one of my favourite places in Victoria, but it could really just as easily be a photo of any number of people or places or things that I care about. And the reason for showing it is because I came to realise over this period that every one of these things that mattered to me, and many more, would be impacted to some degree by the choices that we collectively make today and the decisions and actions we take to address environmental issues. And so in this context, I had a career crisis because I really couldn't see the point in worrying about people's kidneys when we were faced with these much bigger, really, existential threats. But I'd studied for a long time to get to the point that I was at, and I do really enjoy my work and think that it is important. So I moved on from this and instead started thinking about how I might best contribute to these issues with the skill set that I had from within medicine. And luckily I didn't have to think for very long because I realised two things. And the first, which when I say it now seems very obvious but hadn't occurred to me before, was that human health is absolutely fundamentally dependent on a healthy planet. If the planet is not healthy, then there's absolutely no opportunity for us to thrive. And so because of this, there really is a very critical role for health professionals to play in the environmental space. The second thing I realised was that healthcare itself has a very substantial environmental impact. And ironically, this is particularly the case for nephrology because the dialysis, which is the bread and butter sort of therapy for nephrologists, is incredibly resource intensive. Probably even more importantly than this, it doesn't need to be this way. There are much better and smarter ways of doing things. And so I've spent a fair bit of my time over the last 6 or 7 years focusing on these two things. So the environment health links and the issue of healthcare sustainability. And the really great bit about this passage of time is that I have had the opportunity to be exposed to a number of people, or a great number of people, doing really fantastic things. And the result of that is that I've moved from a place where I really did feel like we were in an insurmountable amount of trouble as a species to thinking that, or realising that there are solutions, and that if we collectively choose to adopt them, the likelihood is that we will end up with a much healthier and more prosperous society. So with that said, the overarching aim of my talk today is really to try and get across the message that environmental sustainability is actually core business for people working in health. And that, as I said, there really is, because of this, a very critical role for us to play. I will talk through the relationship between the environment and human health, and then about some of the health issues that we will be confronted by as health professionals as a result of our changing climate. And then thirdly, about the impact of healthcare on the environment, the impact of healthcare itself on the environment. And then at the end, a bit about the roles that health professionals might choose to play and what is already happening in this space in Australia at the moment. And so the environment and health and how they are linked. So to state the obvious, humans do have an absolutely fundamental need for clean water. We need food, we need clean air to breathe, we need to have shelter, and we need a relatively stable climate. And all of these things, these essentially goods and services, are provided to us by nature. But nature does so much more than fulfill just these basic needs. It's also responsible for processing our waste. It protects us against the spread of diseases and pests. It serves as a place for recreation and provides us with opportunities for healthy nature-based jobs in lots of vocations, for instance, in tourism. And it also fosters our mental well-being. It does this to some extent for all of us, but for some cultural and spiritual groups, it really does so in very fundamental ways. Indigenous Australians describe a very profound connection to the land, and this is to the extent that Aboriginal law and spirituality are really intertwined with it, and it actually forms the basis of their culture. I was struck at a conference I attended a while back by an Aboriginal woman who introduced herself as belonging to the Fitzroy River. She said that this was her land, but she belonged to it instead of owning it. And she went on to explain that with this sort of perspective on the relationship between humans and the land came with it a very automatic and ingrained understanding of the need to care for and protect it, which is something that I think is often lost in our society and culture. Another often less well recognised benefit of medicine is that it is in fact, or in essence, a medicine cabinet. With over 50% of all the drugs that we use in healthcare today originally derived from nature. And probably just as importantly, it serves as a repository for new medicines that are not yet in use or even discovered. This photo up here is of a cone snail, which is just a large, extremely venomous predatory sea snail that is commonly found on coral reefs and in tropical tidal zones. These cone snails hold venom inside a gland inside a tooth, and they fire this venom at enemies and prey like a harpoon. If you are unlucky enough to come across this venom in nature, it will potentially kill you, or probably kill you. But it's currently being developed by researchers as an alternative to opioid painkillers. It is potentially 100 times as potent as morphine, but with much less in the way of side effects and lower addictive potential. And so obviously because of this, it holds great promise for use in medicine. The downside to this is that because these cone snails live on coral reefs, the likelihood is, or the concern is, that they will become extinct over the next 10 to 15 years, and then obviously with that remove this potential for humans, or to benefit humans. Simply being in nature also has medicinal potential. So Shinrin-yoku, or forest bathing, is a traditional Japanese practice of immersing yourself in nature. And very simply, it involves walking slowly through a forest and making sure that you use all of your 5 senses and breathe deeply. And a huge range, or a significant number of health benefits have been reported from forest bathing, including things like improvements in blood pressure and cortisol levels, improvements in subjective feelings of stress, and even better immune function. For all these reasons, forest bathing, or certain forests in Japan, are actually protected and accredited for bathing, for forest bathing. And Japanese physicians refer their patients at high risk, particularly of stress-related conditions, to certain forests for specified periods of time. These sort of nature-based prescriptions are yet to really take off around the rest of the world, but there definitely is movement in this direction. I was reading recently about Santa Fe in the United States, where cardiologists prescribe walking in nature as part of a treatment program called Prescription Trails, which is directed at diabetic patients. Similarly, in Washington, D.C., a group of paediatricians have developed this software program, and this time it's directed at their inactive, obese young patients. And what it does is links these patients with their closest park and provides incentives for them to use these parks. As an example of where some of the benefits of nature are being recognised closer to home, everyone will probably recognise the Royal Children's Hospital from down the road. This has been built in such a way that almost all patients have a direct view of Royal Park from their hospital room window, and almost constant access to direct natural light. And these sort of design features were very intentional, and were based on the fact that studies have shown that even having a view of trees and nature outside of a hospital window can hasten recovery, it can reduce the need for pain relief, and actually leads to speedier discharge after surgery. But the flip side to all of this is that for many decades now, we as a species have been changing our planet at an absolutely unprecedented rate. And this is to the extent that the current epoch has been referred to as the Anthropocene, which is an entirely new geological age in which humans are the most dominant influence on the planet. You know, we now live on every continent, and we've had direct impact on 83% of the Earth's surface. We are triggering the rapid loss of both terrestrial and marine life, with Earth on course to see 75% of all species extinct over the next few centuries should current trends continue. We can expect to see more plastic than fish in our seas by 2050. And possibly most significantly of all, we are changing our climate. And this is to the extent that the current concentration of greenhouse gases in our atmosphere and the current mean global temperature are higher today than they have been at any other time that humans have lived and thrived on this planet. In saying this, I think it is really important to recognise at the same time that all of this transformation of the planet has led to very substantial net gains in human health and wellbeing, and in economic development. And really never before have so many of us, had as much as we have now. But not all regions and groups of people have benefited equally. In fact, many have been harmed, and possibly even more significantly, the full costs associated with this transformation of the planet are really only now becoming apparent. And I think this is particularly the case when talking about the health costs. So there is now a reasonable body of work documenting those climate-related health impacts that we are already seeing and that we can expect to increasingly see over the coming decades. But probably some of the best work in this space comes from two separate commissions into climate change and health that were jointly held by the Lancet and the University College London. The 2009 commission, based on very extensive research, clearly made the point that climate change is the biggest global health threat that we are facing this century. Not only that, as said in the quote up there, the effects of climate change on health will affect most populations over coming decades, and from there put the lives and wellbeing of billions of people at risk. The main messages from the 2015 Lancet Commission were that actually the effects of climate change are already substantial and unequivocal, but also, to turn it around, that tackling climate change could somewhat ironically be the greatest global health opportunity that we have available to us this century, and that's something I'll talk through a bit further later on. In terms of how climate change impacts health, this very complicated figure is from the 2015 Lancet Commission, and it actually doesn't get all that much simpler no matter how long you look at it. But what it tries to show is the very complex interactions and varied interactions that exist between greenhouse gas emissions, climate and health. To try and simplify things though, these health impacts are often divided into direct, indirect and deferred and diffuse risks. The direct effects are the most obvious. So these are the morbidity and mortality that arise from things like heat waves and extreme weather events. As an example of indirect effects, so altered temperatures and rainfall patterns that we see with climate change lead to altered distribution of disease vectors such as mosquitoes, and in turn this can lead to altered distribution of mosquito-borne diseases. Dengue and malaria are two that are thought to be particularly concerning and will become increasingly problematic as a consequence of climate change. When talking about the deferred and the diffuse risks, these arise because climate change doesn't just destabilise the ecological systems, but also the social systems that really provide core basic human needs. Climate change has already been linked to social unrest and conflict and population displacement. Another example of a deferred or diffuse risk relates to mental health. You know, the effects of depression on farming communities impacted by drought. The distress that people working in this climate change space experience as a result of having to process all of this sort of information on a daily basis. In terms of the magnitude of these impacts on health, this is very hard to quantify, but the World Health Organization has tried, and it suggested back in 2014 that between 2030 and 2050, we can expect to see an additional 250,000 deaths per year as a result of the very well understood impacts of climate change. The point was made, though, that this represents lower bound figures because it omits the less easily estimatable impacts of climate change. For instance, those that are due to water scarcity or major heat waves, or those that arise from the impact of climate change on social security and conflict. I think it is really important to make the point up front that the consequences of climate change on health will be many magnitudes greater for the world's poorest nations. Obviously, things like heat waves and flooding events have very different implications in regions that have limited access to shelter or very high potential for drinking water contamination. The other point to make about this is that those that will be affected most by climate change are very much those that have contributed the least to the problem. The 2015 Lancet Commission report made the point that the world's poorest 1 billion have contributed less than 3% to the world's total emissions burden. But that being said, we all do share an atmosphere, and global societies are intricately and permanently interconnected. And so because of this, really none of us, no society will be immune over time from the impacts of climate change. And I think it's important to realise that that very much includes us here in Australia. I think many people look at climate change as a quite abstract or distant threat, but there are many examples of those climate-related health impacts that we have already had to face in Australia. Most will remember very clearly the Black Saturday bushfires that led to 173 deaths in Victoria. What's often less well known is that the heatwave that actually preceded those fires led to 374 excess deaths, which is really double the number from the bushfires themselves. I was working in Brisbane at the time of the Queensland floods that impacted a large proportion of the state. The floods themselves led to 33 deaths and had very significant impacts for long periods on both physical and mental health of Queenslanders. On a personal level, I was unable, as were many others, to get to work for 4 days over the period of flooding. And what that meant was that over this period, the hospital operated on skeleton staff. There were very big impacts for the renal community because many of our dialysis patients were unable to access their dialysis units. Most will know that dialysis is actually a life-sustaining therapy for people with end-stage kidney disease. So missed dialysis wasn't in this case, but can be life-threatening. Modelling tells us that we will see longer, hotter and more frequent heat waves over time, and also that bushfires and extreme rainfall events that lead to flooding will be more of a problem. As health professionals or a health community, we will be frontline responders, and so it is really important that we know about this and make sure that we are prepared. A potentially less well recognised impact of climate in Australia is this one. So we have a very high prevalence of allergic and asthmatic disease. Both of those are triggered by plant pollens and fungal spores, and both of those in turn are influenced by climate. The world's largest and most catastrophic thunderstorm asthma event occurred in Melbourne at the end of 2016, and anyone here who is a healthcare worker working at the time will probably remember this because of the impact it had on emergency services and emergency departments. And flowing on from these emergency presentations, there were over 8,000 people hospitalised directly as a consequence of this one event, and tragically 10 deaths, which mostly occurred in young people. Interestingly, if you look at the literature, the European Respiratory Society actually put out a position statement back in 2009 that very clearly stated that we were likely to see more thunderstorm asthma as a consequence of climate change. But obviously this hadn't filtered down to the level of health services in Victoria, because I think it's fair enough to say that on that day we were completely unprepared and only just managed to cope. So I suppose all of this is relatively heavy and depressing information, but before moving on to something more positive, in case the perception is that we have a very major public health problem on our hands that public health physicians need to address, it's actually quite a bit bigger than that. This is a paper I co-authored last year that goes on for many pages talking about the changing spectrum of renal disease that nephrologists are likely to see as a consequence of climate change. It also spends some time talking about the need for preparedness planning among dialysis units for the impacts on health service delivery or dialysis delivery. Much of this recognition came in the wake of Hurricane Katrina in the United States, which was disastrous for dialysis patients over there. But it's not just the renal community that will be affected. The respiratory community also needs to pay attention. We know that there will be impacts on cardiopulmonary health. I've talked a little bit about infectious diseases and also about mental health and even skin. Really, over time, there has been increasing recognition that climate change is unlikely to really spare any individual organ system. But there is a positive side to this. I've talked a little bit about the somewhat dire health projections outlined in the 2015 Lancet Commission report, but the main message of this paper was not actually that we have a problem, but that tackling climate change could actually be the greatest global health opportunity available to us this century. There are many solutions to climate change. There are many ways that we can act to reduce greenhouse gas emissions, and if we choose to do this, this will protect us against both the direct and the indirect and those deferred and diffuse risks to health that arise from climate change. But many of these solutions actually have the ability to also benefit health through mechanisms quite independent of climate. And these are the so-called health benefits of climate change mitigation. One of the most obvious examples relates to transitioning away from our dependence on fossil fuels towards renewable energy generation. This will mitigate the health impacts of climate change, but also save lives and improve health immediately as a result of reducing air pollution. Air pollution has been thought or been suggested that it contributes to about 7 million deaths annually. Identifying and publishing about all of these co-benefits is really important because it really does have the potential to change the discussion. Moving it away from sort of a narrow environmental or economic focus to all of a sudden being one about potential health gains for society. The transport sector is another area where there are large co-benefits to be found. The transport industry is responsible for up near a quarter of all global greenhouse gas emissions. If we were to shift away from petrol and diesel transportation, this would not only combat those emissions, it would also reduce the impacts of climate change on health and air pollution. So, one way we could approach this is working as hard as we can to introduce policies and procedures and infrastructure to transition to electric vehicle use. But the other point here to recognise is that physical inactivity is a risk factor for a broad range of chronic diseases, and itself is thought to contribute to around 3 million deaths annually. On the flip side, major health benefits accrue from walking and cycling and even catching public transport, so-called active travel. And as can be seen on the slide, there are multiple studies that exist showing the kind of benefits that we would be likely to see were we to shift in this direction and make active transport safe and accessible for a greater proportion of the population. Similarly, in the agriculture industry, agriculture and livestock production and forestry together contribute, again, about a quarter of all global greenhouse gas emissions. Modelling tells us that if we were to cut consumption of meat and dairy and eggs by half, this would have a great effect on greenhouse gas emissions, but also significantly reduce saturated fat intake in the diet. And in turn, this would be expected to reduce risks of things like obesity, heart disease, diabetes, and even some cancers. You know, one study has shown that if we were to transition to a more plant-based diet, but still in line with standard dietary guidelines, we could reduce global mortality by somewhere up near 10%. Just to speak for a moment about the economics of all of this, there is often concern voiced about the cost of policies that drive a move towards renewable energy generation, or the costs of reconfiguring our transport systems. But most of these analyses have failed to consider the averted healthcare costs. You know, one study, the first one mentioned up there from the United States, has shown that health benefits from reducing air pollution could actually offset the cost of US carbon policies by anywhere between 25 and 1,050%, depending on the policies chosen. A study from the UK has shown that if we were to increase active travel in England and Wales so that it could reach the level seen in somewhere like Copenhagen, the cost savings to the NHS in the UK would be somewhere near 17 billion over a 20-year period. So, you know, I've talked so far about the environment and environmental health impacts of climate change, but the other side to all of this is the environmental impact of healthcare itself. We've known for some time that healthcare in the United States contributes about 10% to total US emissions. In the UK, the figure is quite significantly lower at 4%. We've never had this data available in Australia until earlier this year, thanks to some really great work led by Forbes McGain, an anaesthetist from Western Hospital. And what his group showed was that in Australia, healthcare contributes somewhere around 7% to our total emissions. And this is not insignificant. This is essentially the same as the carbon footprint of all people living in the state of South Australia. And I think this really creates a problem for a profession whose primary mandate is to first do no harm. And as I said at the beginning, this is particularly the case when it doesn't need to be this way, when there are better ways of delivering healthcare. The quote up there is one from the BMJ a number of years ago that I think makes a really valid point, and that is that healthcare actually has a responsibility to get its own house in order, so that we can avoid this paradox of doing harm while seeking to do good. A little bit more about this paradox. A number of pieces of work have been performed to try and quantify the harm caused by healthcare, and these are a few examples. Looking at the first one, a US study has shown that direct expenses arising from emissions from a single healthcare facility totaled around 2.4 million over 1 year, but the indirect societal costs as a result of those emissions from things like premature deaths, chronic bronchitis, etc., actually totaled closer to 23 million. The last one, a European Union example, what's been shown there is that if the EU were to adopt, say, a 30% rather than a 20% emissions reduction target, what this could do is produce health savings from diseases arising from air pollution, somewhere in the order of between 10 and 30 billion euros per year. In the paper on the carbon footprint of the Australian healthcare system by Forbes McGain that I mentioned before, he talks about the simple, some or many of the simple clinical decisions we can make on a day-to-day basis to actually reduce the environmental impact of healthcare. An example he gives that has also been echoed in a recent position statement from the Australian New Zealand College of Anaesthetists relates to anaesthetic gases, which themselves have very, very significant and sustained environmental impact. But this impact can be reduced by clinicians. Depending what is appropriate for an individual patient that is there at the time, anaesthetists can choose to utilise low-flow anaesthesia. They can choose agents that have lower environmental impact than the others available. They can choose to use regional or greater IV anaesthesia. At Western Health in Victoria, anaesthetists have made the switch over the last few years from the very expensive anaesthetic gas desflurane with very high global warming potential to sevoflurane, which is a gas with that is a lot cheaper but also has less emissions intensity. What they've shown is that by doing so, they can significantly reduce the carbon footprint of their service, but also save the hospital a fair amount of money. Another example, this time from nephrology. This is an automated peritoneal dialysis machine, and patients with end-stage kidney disease that use this therapy hook up to this machine through a catheter into their abdomen each night. They drain all of that fluid in, and then the next morning they drain it out. with all the waste products from their body. There are 3 different methods available for draining this APD effluent. You can either attach a drain bag, a plastic drain bag, drain into that and then throw that into the bin. You can connect a long plastic drain line and then drain into the bottom of your sink or shower, or you can drain into one of these reusable drums that you can see up at the bottom of the picture here. Some of the nurses that I work with did some really simple calculations and showed that if you choose to drain into the reusable drum, you not only produce far less plastic waste per treatment, but again, you also save the hospital and the healthcare system a fair amount of money. The other great thing about this particular initiative when we implemented it in our renal unit was that the patients loved it, because the amount of waste that they generate on a daily basis is more than most of them can cope with a single curbside council bin that they're given each week. We also need to think not just about our clinical decisions, but also the way we deliver care. Many will know that following kidney transplantation, follow-up is incredibly intensive. So in the early days after transplant, you need to be seen every day, then 3 times a week. That's gradually spaced out over time, but people need to be seen on a regular basis ongoing for the life that their kidney transplant continues to function. Early on, patients that live away from the hospital have to relocate so that they are close by. Over the long term, this imposes significant costs and time commitment for travel. Back in 2016, our unit over at the Royal Melbourne Hospital implemented a telehealth service for follow-up of regional kidney transplant recipients that didn't have access to local nephrology cover. Since that time, we've had 63 patients utilise this service, and we've conducted 385 clinical reviews via telehealth. From just this number of patients, we have saved the equivalent to 7.9 trips around the world in travel distance, and a huge amount of greenhouse gases. And one way of looking at the environmental benefits of this particular initiative is that it's really the same as all of our department going out and planting 1,500 seedling trees and then slowly watching them grow for 10 years. Again, the really great thing about this initiative is that patient feedback has been universally positive, and not one of those patients has chosen to return to face-to-face care. We are currently formally looking at safety or patient outcomes of telehealth versus standard care, but there have been no patient safety issues obviously identified. And this is just one patient story from prior to the time of telehealth. She lives in Mildura, and she used to have to set her alarm for 4:30 in the morning to catch a flight to Melbourne, to sit in peak hour traffic, to sit in outpatients waiting for us to be seen. We would see her for an absolute maximum of 20 minutes. She would then wait around again to get a flight back home. And overall, this was 12 plus hours of travel time for this very brief specialist consultation. The average cost was $500 for that round trip. She would be reimbursed for that, but had trouble finding the money up front. And in the end, this cost is obviously borne by the healthcare system and the Australian government. To take this idea even further, this is another graph from the carbon footprint of Australian healthcare paper, and what it shows is the vast majority of the impact or the environmental impact of our healthcare system arises from hospitals, and with things like general practice and public health really contributing a much, much smaller amount. What this suggests is that in addition to changes or us needing changes at the institutional level, there is also a need for structural changes to our very treatment-focused health system with its real focus on tertiary institutions. Most people would know that the illnesses that produce the largest burden both in our hospitals and in society, things like obesity, diabetes, cardiovascular disease, are all largely preventable. But despite this, we allocate less than 2% of our overall health budget to primary and preventative care. The other point to make is that all of these chronic conditions need to be treated with medications. This is extremely expensive for the healthcare system. And if you go back to this slide, pharmaceutical usage is responsible for 19% of the carbon footprint of healthcare. If we are to deliver care on an ongoing basis in a cost-effective and sustainable way, it's really vital that we start to think more about prioritising prevention over treatment in these sorts of hospitals. And the other priority really needs to be on primary care and general practice. This is the interface in our health system where all of these chronic diseases are initially diagnosed and managed. There is very clear international evidence that having a strong primary healthcare orientation within a healthcare system can reduce costs. It makes for a more efficient health system, it reduces hospitalisations, and overall it leads to better public health outcomes. To some degree, this has been recognised by the government. This is a report from the government on the state of health of Australians back in 2015. And in this, the comment was made that a strong and readily accessible primary healthcare system really is vital to reduce the pressure on public hospitals. But I think it's very much fair enough to say that we have a long way to go in this. You know, there has been no proportional increase in funding to primary and preventative care over time, and there's been no mention of this in any subsequent statements that have come out from the government. So to tie a bit of this together, you know, I've talked about the fact that environmental change impacts health, and then in turn, this actually impacts healthcare. And the point to make here is that what this does is add to an already very stressed healthcare system. You know, we have an ageing population. The burden of non-communicable diseases in society is growing at an absolutely exponential rate. Very expensive medical technology continues to advance, and climate change, as I've discussed, will increasingly threaten human health and well-being. So I think that it's a very valid comment that's quoted down the bottom there, that the future of expanding high-quality healthcare really does demand that we work out a way to deliver it so that it's financially and environmentally sustainable. So moving on from this, the next thing to consider is really why all of this matters. You know, why is it important that the healthcare community knows about all of this? And I think there really are three main reasons. You know, the first is to do with workforce preparedness. The second is to do with healthcare sustainability. And the third is to do with environmental advocacy. So I make the point in this slide that, you know, tomorrow's health professionals need to be prepared for clinical practice in a climate changing world. But I think actually this very much applies to today's health professionals as well. You know, in Australia, those working in rural communities need to be cognizant of the effects of drought on the mental health of farming communities. All of us need to know which patients are vulnerable during heat waves and to provide them with appropriate advice. In the renal community, we have all of our patients on medications that impair thermoregulation, diuretics, beta blockers, ACE inhibitors. You know, we need to know to tell our patients to stop these drugs, not just when they get sick, but also on hot days. We need to be able to warn patients with respiratory disease about the risks in pollen season, and particularly the very extreme risks that exist in the case of thunderstorms. All of us need to contribute to emergency planning for our health services, you know, to help prepare us for how we will cope as we see increasing heat waves and bushfires and flooding events. We also need to know that we are part of the problem, that healthcare is part of the problem, but also that we can contribute to solutions. We need to know that we need to think about the impact of our day-to-day practice, but also identify and promote and be willing to adopt more innovative and more sustainable models of care. And the last reason that I think all of this is really important is to do with environmental advocacy. You know, as a profession, or health professionals at large, we do have a very long and proud history of taking action on both the social and political stage about issues that threaten human health and well-being. And this dates way back to health professionals speaking out about slavery, cholera, smoking and tobacco, nuclear proliferation. I think it's fair enough to say we have a fair bit of advocacy to do in the field of obesity, and certainly there's much more of a role that the health community can play in the climate change and sustainable development space. I think that being said, it is really important to realise that if we do choose to advocate, we are a really powerful voice. You know, we are generally very much trusted and respected members of society. You know, we have just about unparalleled experience of translating complex scientific ideas into concepts that people can understand. We typically speak from a position of science, and I think that that is incredibly important at the moment to counter some of the ideological arguments that are out there, particularly in the Australian political arena. The other thing is that health really does put a human face to what is otherwise an abstract concept. You know, by approaching climate change as a health issue, we're likely to achieve much greater resonance than we would if we approached it purely as an environmental or an economic issue. The other reason advocacy is important is that as a profession, we really do have an obligation to speak out for those with less of a voice. You know, that includes vulnerable populations, which very much includes many of our patients, but also, very importantly, future generations. The last reason that I think advocacy is important ties back to some of those health co-benefits that I talked about before. You know, we are uniquely placed to advocate for policies that benefit both people and the planet. You know, as commitment to combat climate change increases over coming decades, as it will, trillions of dollars are likely to be allocated to greenhouse gas mitigation. And that really presents all of us with an opportunity to advocate specifically for those policies that will lead to the best health outcomes for our patients, but also for broader global populations and again for future generations. And just for my last few slides, I thought I would talk a little bit about what is already happening in this space in Australia. Some here may have heard of Lancet Countdown. This follows on from the 2015 Lancet Commission and is essentially a very large international multidisciplinary research collaboration that aims to monitor and track both research and progress on the relationship between climate and health. And from there to highlight the implications or the relevance for national governments. This Lancet Countdown group reports annually, and following the release of the 2017 report, the Lancet Countdown group, in partnership with both the Royal Australian College of Physicians and the Australian Medical Students Association, developed a policy brief for our politicians. This came up with 4 very specific recommendations about what was needed in the policy space to address climate change and health in Australia. As yet, none of those have been adopted by our government, but it still is a very impressive piece of work. The 2018 report is due to be released at the end of this month. And again, will come with it a brief for Australian policymakers. So for anyone interested, it's worth a look at that. The Royal Australian College of Physicians is doing some great work, including putting out 3 position statements over the last few years on climate change and health, environmentally sustainable healthcare, and the health co-benefits of climate change mitigation. The RACP has also just this year driven a roundtable forum involving the Council of Presidents of Medical Colleges. The point of this roundtable was really to discuss the risks of climate change to both human health in Australia and healthcare. And at the roundtable, it was agreed that there really was a need for evidence-based strategies for management of these risks, and also the need for us to look at the sustainability profile of our healthcare system. Following this roundtable, a communique was put out, and this was signed by 11 medical colleges, which really is the bulk of medical colleges in Australia. It's not so much the discussions or the outcome that I think are important here, but the fact that what it really reflects is that the health community in Australia is recognising that we have a problem and that we all have a role to play in addressing it. It also does a lot to really mainstream the idea of climate change and health. Individual societies are also doing work in this space. So I've mentioned the Australian New Zealand College of Anaesthetists, who have put out a position statement on environmentally sustainable anaesthesia and pain medicine. Similarly, the Australian New Zealand Society of Nephrology is looking at this. There has also been recognition over the recent years that it is really vital that we incorporate these kind of concepts and teachings into our medical curriculum. The Medical Deans of Australia and New Zealand is really the peak professional body for medical education in Australia. And back in 2016, it formed a working group to look at how this might best be achieved, you know, how to make these sort of teachings mainstream in universities. Medical students are also very much getting on board. In many cases, they're ahead of most of their senior colleagues. The Australian Medical Students Association has put together a really fantastic short online course that teaches about climate change and health, directed at medical students, but freely available to everyone. In terms of what's happening at the level of healthcare services, as of a few years ago, all public hospitals and health services are required by, in Victoria, are required by the Department of Health and Human Services to have an environmental management plan in place and to report publicly on environmental outcomes. Many hospitals across the state now have sustainability officers, and I think these people, or these individuals, are really vital in driving a sort of, or coordinating the sort of change that we need to see in hospitals. And in most cases, I think probably in all cases, it's been shown that these sustainability officers very quickly pay for themselves by saving resources and costs for the hospital. Using my own hospital, Melbourne Health, as an example, we have a Think Green committee, which is comprised of clinicians, people in administration and people at executive level in the hospital. We have an environmental strategy in place and are currently working on a new strategy for the upcoming 5 years. And I think it's fair to say that this is likely to be, you know, a much more ambitious strategy than the one before, because this sort of ambition within our hospital at least is growing all the time. You know, we have 160 green champions in the hospital who have come forward to work with the Think Green committee to drive change from within their own units or departments. So I think the answer to this question of what is already happening is that there are many good things happening. But at the same time, it's really important to recognise that as health professionals, we really have come to this debate very late. And so because of this, our response really does need to be expanded and accelerated along with the rest of the global commitment to combat climate change. Just to return to the big picture towards the end, obviously health is our focus here, but I think it really is important to recognise that there is just so much more, if there could be more at stake here. I attended a talk a while back by Bob Brown, who most in this audience would know. He was a doctor, he ex-Green senator and environmental activist. He's also a fantastic orator, but he said three things at this talk that particularly stuck with me. The first was that we live on an extraordinary planet. It really is the only one we know of that is capable of sustaining us, and not just sustaining us, but allowing us to thrive. The second thing he said was that it is an extraordinary privilege to be alive at a time when the fate of this planet is being decided. And his third comment was that this presents all of us with an extraordinary opportunity to ask the question, what can I do? We in the West really are empowered like no others to create change. And I think as health professionals in the West, this is particularly the case. We have a strong or powerful motivation. We will be directly confronted by the health impacts of environmental change. We have a powerful voice and we have a very powerful message. And so because of that, I really do feel there's a very critical role for all of us to play. So to conclude, I hope I have somewhat shown that human health absolutely relies on a healthy planet, and that human-induced environmental change really does threaten human health in unprecedented ways. Not only that, healthcare, and therefore we contribute to the problem. And so it is really important that we engage in this issue so that we are prepared for what comes our way as a result of climate change, but also so we can address the impact of our own practice and choose to advocate for change. This is a quote that I particularly like by the past Secretary General of the United Nations, Ban Ki-moon, who makes the comment that saving our planet and lifting people out of poverty and improving health, these really are all one and the same fight. We really do need to join the dots between climate change and resource usage and empowering women and global health, and while finding solutions for one problem, really make sure that these solutions are solutions for all. And my last slide, this is an old cartoon, but one that I particularly like. And I think it really just does highlight what I said back at the beginning, that, if we choose to adopt solutions or to drive solutions for climate change, we will not only address the problem of climate change, but in the process, really go down a no-regret path and end up with a much more healthier and more prosperous society. So with that said, I'd just like to acknowledge Doctors for the Environment that Professor Doherty mentioned briefly at the beginning. This is an organisation of doctors, and it really is an incredibly passionate and committed, although very time-poor group of people that are doing some really great work in this space. Just to plug a little bit of DEA's recent work, everyone will know that we have a state election next weekend, and DEA has no political persuasion. But in the lead up to the election, it's developed this sort of document that I've put up here, which is a prescription for a healthy Victoria. And what it does is highlight the kind of policies and the actions we need our politicians to make sure that Victorians remain healthy. Really the point of it is to try and get those who read it to make the links between the environment and health and think about this when they're casting their vote. And I have a little collection of these up here if anyone would like to read them or distribute them to interested people. And so that's all, but very happy to take any questions.
Thanks, Katherine. That's terrific. And you've taken us from think globally, which when you think globally about this issue, you can get into a kind of despair, which you described. But if you act locally and you act from within your own expertise, in your own area of influence, you can not only have some positive effects, you actually save money, which should appeal to politicians, but they're pretty thick, these guys, or some of them are, anyway. So we now have time for questions, and we've got a good amount of time for questions, so there's a microphone if you'd like to put your hand up and make a comment or a question, that would be most welcome.
Stunned.
For the students, if there are any, there's of course Doctors for the Environment Australia has an extremely strong student chapter, but I'm sure everyone's aware of that.
Yeah.
In in the medical students group, and I've talked to a lot of students over the years, especially medical students, and they're certainly passionately committed to acting on this. So we've got two questions over here.
So I've talked here mainly about doctors for the environment, but there are also a number of other health groups that are focusing on this. The Australian Nursing and Midwifery Association in Victoria is doing fantastic things. There's now a pharmacist for the environment, so there's lots of roles or places to work for other health professionals apart from doctors.
Hi, my name is Jerry Elwood at the University of Melbourne as the Manager of Sustainable Campus Design. So part of my role is implementing sustainability in the university's operations. I'm interested in your thoughts on what an institution like the university could do to help the medical profession in, I suppose, both the training of the future workforce, but also in the facilities that we provide. Could they better exemplify the sorts of things that doctors should be advocating for out in society?
So sorry, you mean, so you're interested in how the actual curriculum could be changed, but also how...
My personal background is more in the design of buildings and facilities, but I'm interested in the role of universities as training the future workforce. What sort of things specifically doing?
Well, I mean, universities are obviously thought leaders in society, and so I think that universities taking a strong stand and being a loud voice in this is really important. And I mean, I actually think that's incredibly easy to do because, as Professor Doherty said, the students are already leaving most of us behind with all of this. I suppose from a university perspective, I know that the University of Melbourne is doing some really great things in this space with their campuses and facilities, but probably really trying to publicise that is important so that everyone knows what you're doing. I suppose the other thing is, a lot of people do publicise sustainability, but often the health links aren't made. And I think, as I've said, that's a really powerful message that all of this is not just important to save the planet. I mean, I suppose at the end of the day, the planet's going to be fine. It's us that will be in trouble in the longer term. So, that all of this is important, not just for the environment and kind of social responsibility, but also for the sake of human health. In terms of teachings in universities, I think it's absolutely vital that it threads through every course. It's fundamentally important for health, but it's as I said, it's really all of our life support system, and so it should be infiltrated through every discipline. I mean, I'm not quite sure how that would structurally work within a university, but just making sure it is a discussion point at every possible opportunity, I would think is very important.
Yeah, certainly the built environment's enormously important. If you look at our new building across the street, you'll notice that it's got sort of browny-looking windows. That reflects that the two layers of glass are that far apart, and there are brown slats of wood in between them. And so it's a very actually environmentally efficient building.
Yeah,
we're very proud in that sense. Yeah.
I'm talking, it might not be appropriate at this meeting, but I mean, it is absolutely ridiculous that many buildings are still being built today that are not environmentally friendly, and this is an incredible new hospital, but interestingly the power usage and energy consumption of this hospital is greater than the Royal Melbourne, which was built many decades ago, and that's because the massive atrium is almost impossible to heat and cool, and it really seems to be a very big missed opportunity that we're still not having this front and centre in our minds when we're building new hospitals and new universities, etc., etc. So somehow this needs to get into the underlying psyche of the entire hospital. I think that's why having sustainability officers in hospitals are really important. You can have individuals in the hospital that care about this and know about this, but you need someone whose primary job is to make sure this is sort of front and centre, which is obviously what you do in the university and what our sustainability officer who's in the audience does at our hospital.
Yes, it always amazes me that governments complain about the cost of actually doing anything, but actually you can create an enormous number of jobs and opportunities and so forth by building much more sustainably and by promoting activity that we can encourage resilience, even getting new refrigerators more efficient. I mean, there's all sorts of things that can be done.
And the really good thing about all of this in many cases is that, being environmentally friendly involves conserving resources, and if you conserve resources, you save money. So as long as you can have even sort of medium-term sightedness, all of this is relatively easy. It's just that you've got to come up with that initial money and see past the first couple of years.
So you have another question?
Hi, Hi.
Have we got the microphone?
Yeah, I do. Do you want me? So I think hospitals in particular organisations are increasingly driven by metrics. And as we're developing our sustainability strategy, I'm wondering what sorts of activities or what sort of measurements you have in mind for the renal department or the hospital in terms of things that we can actually do practically and measure, I guess, to demonstrate the efficacy of what it is we're trying to do around sustainability, particularly in hospitals.
Yeah, I mean, I suppose to answer that, we've got a little green group within our nephrology department, and over the last few years, we've tried really hard to do all sorts of things, and at almost every point, we've been blocked by hospital infrastructure. So, you know, we try to conserve paper, but the procurement policy says we can't purchase a certain amount. We want to upgrade our lights, but the hospital doesn't pay enough for electricity to make any sort of business case ever feasible. And so, you know, what we decided to do as a nephrology group was to work more with the Think Green Committee and see if we can make sort of structural changes within the hospital so that all of this sort of thing is easy and we're not all banging our heads against a brick wall. We are in the process, as I said, about to start developing our next strategic plan. That's going to start with a stakeholder workshop, which will involve clinicians and really anyone interested from all different levels of the hospital. We'll get a whole lot of ideas in place, and then the plan is to end up with a strategic plan that doesn't just say what we want to do, but has targets and things that we measure and timeframes and people responsible, so that all of this just becomes part of the functioning of the hospital. So it's difficult to say what sort of things. There are so many things that you could do. It's just a matter of making them easy and actually happen. The Western Health I've talked a little bit about. They've got a fantastic strategy in place and are really kicking goals in this area. There's another hospital in Sydney that similarly has done great things, and so all of this is very possible. It just needs to start with a really good strategy and buy-in from all levels of the hospital.
No, I think you see this right across this area. If you have enlightened policy and governance, you can really move it ahead. But it's very difficult for individuals or small groups to move it ahead. Catherine's given us some good examples of how you can do that. From just personal initiative. But
I suppose the flip side to that is you need the policies and governance. Yeah. And if you don't have it, those small groups that are getting nowhere, if they put enough pressure on the people up above, then things change. And that's, I guess, how we decided to try and act. We weren't getting there ourselves, so we pushed higher up, and there was a great response. I mean, I think generally people are really receptive to all of these ideas. It's just that it's not front and centre of mind. And
so it's essential for the young, and I regard Katherine as very young, to take over, basically, and control the situation. So do we have more comments? Anyone from there? Yes.
Yeah, I was just interested to know some advice on starting a green group with research. Suggestions how you went about forming knowledge in nephrology.
I mean, I think the first point to make is that a group's really important. It's that you're never going to get anywhere on your own, and it is, it can be quite isolating as you hit brick walls to not have a group doing things. We actually started, when I started working in the department a number of years ago, I just sent an email around and said, does anyone else get bothered by, X, Y, and Z? And there was, very quickly a group of people that came forward that were interested. We actually have a number of research coordinators that sit on our green group, and they're doing some fantastic things with sending all the, thousands of expired tubes and research stock that you order and never get to use to places that can use them, and it would potentially be worth being put in touch with them to see some of the things that they're doing. The way we started was then we just sat down and brainstormed about what we thought needed to be fixed, and then went through picking one of them off after another. As I said, we didn't get very far with most of them because of the hospital, but still, collectively, I think we've done a fair few things. Our department won the Premier Sustainability Award for some waste initiatives. Was it last year, Monica, or the year before? Yeah, so we've definitely achieved things, but it's been slower because the hospital hasn't necessarily had the infrastructure to support it. I mean, that being said, I should say, particularly with Monica in the room, the hospital as a whole has done fantastic things. Particularly in the field of waste, we've reduced waste by, I think, about 33%, clinical waste. and it saves a lot of money for the hospital in the process. But you know, there is obviously a lot more that can be done, and many of us that get frustrated when it doesn't happen very fast.
Okay, well, I guess it's 2 o'clock and we're supposed to close it out, and so I'd like to thank Katherine.
Thank you.